Hello, happy to connect back again. Tuning on to the transfusion medicine subject. Today we are going to discuss about the donor screening criteria, including those criteria which is followed in India according to the Drugs and Cosmetic Act, which is being updated till date. And this criteria will also include that criteria which is used for the convalescent plasma donors for COVID, which is being used nowadays for severe or moderate type of COVID treatment. The discussion will be very limited to the Indian guidelines which is being followed in all the institutes for blood donation. Coming on to the general criteria, the well-being of the donor should be assessed by the interview with the donor, whether he is having a good state of mind to donate and whether he is aware of all the consequences and the process of donation. Coming on to the age criteria, it is 18 to 65 years, but if a person is coming for the first time, his maximum age limit is 60 years. If he is a repeat donor, he can donate till 65 years, and for our FRSs, it is 18 to 60 years is the age limit. Coming on to the weight criteria, for 350 ml of blood collection, the donor should have at least 45 kg, and for 450 ml collection he should have 55 kg, and for FRSS donation he should have minimum 50 kg. And the interval between each donation, for males it is 3 months and for females it is 4 months because of the menstrual process happening in females. But however, this criteria is not so strict, and one can even increase this interval according to their hemoglobin level. And for FRSs, there should be at least 48 hours gap between two subsequent FRSs, but this frequency should not be more than 2 per week and maximum of 24 per year. And the interval between a whole blood donation and a platelet FRSs and vice versa is 28 days. This is a new update which was updated recently on March 11, 2020. And this 28 days gap, this vice versa gap, is when the full reinfusion has occurred during the process of pheresis. But if the reinfusion is not complete, then the interval between the platelet pheresis and the next whole blood donation can be made as 90 days. And if a person is have given some many bone marrow harvest, then he can wait for a period of 1 year for the next donation. And if a person has donated his peripheral stem cells, he should wait for a next 6 months period before any donation. Coming on to the vitals part, the BP criteria is systolic BP 100 to 140 millimeter mercury and diastolic BP is 60 to 90 millimeter mercury. And a person who is hypertensive and is taking drugs, he can be taken for donation only if his medicines or the dose of his medicine was not altered in the past 1 week prior to the donation. And we should also make sure that such persons do not have any features of end organ damage. And coming on to the pulse, it should be 60 to 100 per minute and regular rhythm, and hemoglobin should be more than or equal to 12.5, and even thalassemia trait people can be accepted for donation if their hemoglobin meets this criteria. And coming on to the food, the person should have taken 4 hours prior to the donation. This is to avoid any episodes of vomiting during donation. And if the person is a regular alcohol drinker or if he is a regular smoker, he should be deferred from donation because of the risk of the adverse reactions during the donation process. And coming on to the occupation, any people involved in any strenuous exercise or strenuous work or any emergency service or below or above sea level occupations like air crew members or long distance drivers, these people have to take at least a 24-hour gap after the donation, and they should not have had all these kind of works 24 hours prior to their donation. And also another one part which is being missed here is the history of high risk behavior, whether they have any extramarital affairs or any extra multiple sexual partners, or nowadays, since we have this reason of COVID, we should also ask the travel history and their residence to rule out whether they come from any very hot zones or red zones of COVID. And also the skin, the phlebotomy site which we are going to take for donation has to be examined, and in case of any tinea infection or any local skin infection, they should be deferred. Coming on to the females, females, usually we do not take donations from females during the period of menstruation. The number of days can differ from person to person. It may be 3 days or 5 days or 10 days, but usually we do not take at the time of menstruation. Even if she comes on the next day of menstruation, the next day of her last menstrual day, and if her hemoglobin is okay, we can take her for donation. And post pregnancy, a female should be deferred for a period of 1 year, and post abortion, a female should be deferred for a period of 6 months, and any breastfeeding females are also deferred till the period of lactation. Another on general history we have to ask is the history of any recent blood transfusion, both in the donor and in the spouse. If there is any positive history of any blood transfusion, we have to defer them for a period of 12 months to prevent any blood transmissible infections being transmitted through their blood to the recipients. Coming on to the system wise criteria, coming on to the respiratory system, if a person is a known asthmatic, even if he is under treatment or not under treatment, we have to permanently defer them from donation. And any cases of chronic sinusitis, if they come for donation, we can accept them for donation unless or until he is on any antibiotics. Coming on to the surgery history, if a donor has any history of major surgeries, he should be deferred for a period of 12 months, and in case of any minor surgeries, he has to be deferred for a period of 6 months. This minor surgery also includes the dental procedures, like dental invasive procedures like tooth extraction and root canal treatment. But however, minor dental procedures like scaling, whitening, those doesn't matter. Coming on to the cardiovascular system, if a person has had any cardiac surgery or any cancer surgery, and if he's taking any cardiac medications, or he's some any known case of cardiac disease, we have to permanently defer him. In case of CNS, if a person is having migraine, but if his symptoms are very mild and his frequency is less than 1 per week, we can take him for donation. But those people who are taking any anticonvulsants or epilepsies or seizures, as we have to permanently defer them. All kind of psychiatric disorders, mild psychiatric disorders with people with good state of mind and good awareness, we can take them for donation if they are stable regardless of their treatment at present. Coming on to the endocrine part, since most of our population is diabetic, if any diabetic donor comes for donation, we can accept him only if he is under control due to any diabetic diet or any oral hypoglycemic agents. But if he is taking insulin, we have to permanently defer him from donation. And if a person is having any orthostatic hypertension history, or if he is having any evidence of infection or neuropathy or vascular disease with peripheral ulcers or any multi-organ failure, we have to permanently defer them. And also, if a person, as I said, if a person is taking any oral drugs, we can accept them for donation, but we have to make sure that his dose or his tablet has not been changed in the last 1 month. And coming on to the thyroid, this is a new fact to most of the residents, I hope, because those people on anti-thyroid drugs should be permanently deferred from donation, but this is not followed in most of the blood centers and blood camps conducted. But we can accept them if he is having any benign disease and if he is euthyroid. But like some many asymptomatic goiter or history of viral thyroiditis or autoimmune thyroiditis, all the benign conditions, we can accept them, but we have to defer if he is under any investigation for thyroid or unknown thyroid disease, and we have to defer them if he is on any anti-thyroid drugs. And the permanent deferral in case of thyroid also includes those with thyrotoxicosis due to Graves' disease or hyper or hypothyroidism or a history of any malignant thyroid tumors. And without doubt, all the other endocrine diseases, people suffering from endocrine diseases should be permanently deferred from donation of their components. Coming on to the sexually transmitted infections, histories related to that. If any person is telling history of hepatitis B or C or any unknown hepatitis, please defer them permanently. But if a person is saying that he is in a known case of, or if he is having any evidence in his hand that he is a known case of hepatitis A or hepatitis E, you can accept them for donation. But make sure that there is a 1 year gap from the time of diagnosis and now. And the person should be asymptomatic. That is, he should not have any jaundice at the time of appearing in the blood center. And ask for the history of any close contact with any known cases of hepatitis in the past 1 year. Also ask for the histories, high risk histories like tattoo, acupuncture and invasive cosmetic procedures. Cosmetic procedures I mean are the ear piercing, nose piercing and all the unhealthy invasive cosmetic procedures. And if any person is has been undergoing all these kind of tattoo or acupuncture or this ear piercing or nose piercing, please defer them for the next 1 year period. And we have to ask for the history of blood or blood component transfusion in the partner partner, and if there is any positive history, we have to defer them for the next 1 year. And we have to ask for the history of jaundice, but not all jaundice are dangerous. If the person is having a history of jaundice associated with any gallstones or any rheumatoid disease or mononucleosis, or he's telling a very old history of jaundice during his neonatal period, we can accept them. And if a person is having any chronic liver disease or liver failure, we have to permanently defer them. And we have to ask for the symptoms of AIDS like prolonged lymphadenopathy or prolonged and repeated fever or prolonged and repeated diarrhea, irrespective of the HIV risk. Along with the sexually transmitted infections history, we have to note down that we have to ask for the history of any syphilis or gonorrhea with evidence of genital sores or generalized skin rashes in both the donors and their spouse or sexual partner has to be asked. And in case of any positive history, we have to permanently defer them. Coming on to some of the miscellaneous histories which we encountered during the donor interview. These are like measles, mumps and chickenpox. Chickenpox is very commonly said by many donors, and in case of such infections like measles, mumps and chickenpox, we have to defer them for a period of 2 weeks. 2 weeks, please note it down, that 2 weeks starting from the last day of recovery from the chickenpox. Okay. And coming on to the malaria, it should be 3 months, and for typhoid it is 12 months. All the diseases which I am telling here are that period from the last day of their recovery or last day of their medication till date. We have to defer them for these such periods. And in case of any dengue or chikungunya, we have to defer them for 6 months period. And we have to ask for the history of residence, as I said before, to see whether that area is having any endemic source of dengue or chikungunya. If so, we have to defer them for 4 weeks after return from those places or after he's become febrile. And in case of any Zika or West Nile virus, however, they are not very common in India, but however Zika and West Nile virus, we have to ask for the history of travel, and if any positive history is there, we have to defer them for a period of 4 months after recovery or 4 months after history of travel to such endemic areas. And in case of tuberculosis, as India is a country of tuberculosis, we have to know this. If a person is telling a history of tuberculosis, we have to defer them from donation for 2 years period following confirmation of cure. From the day of confirmation of cure, we have to defer them for 2 years, and after that they can donate their blood anytime. Leishmaniasis and leprosy, we have to permanently defer them. All these deferral criteria, permanent deferral criteria, which I am saying in between, will be summarized at the end of this discussion, so don't get confused. And coming on to the conjunctivitis part, during the time of illness of conjunctivitis, we have to defer them, and this does not suit for all kind of conjunctivitis like some many temporary conjunctivitis. It is like for features of viral or bacterial conjunctivitis only. And in case of any osteomyelitis, the donor should be deferred for a period of 2 years followed by the complete cure or complete treatment. Coming on to organ specific wise, related to kidney, if a person is suffering from any pyelonephritis, he should be deferred for 6 months period from recovery or from the last day of his diagnosis. And if he is suffering from any UTI or cystitis, he should be deferred for a period of 2 weeks from recovery, and we have to make sure that he is not on any antibiotics at present. In case of any CKD or renal failure, we have to permanently defer them. In case of coming to the cases of abdominal disorders, like if he's having diarrhea, history of diarrhea the previous week, if associated with fever, we have to defer him for about 2 weeks after complete recovery, because in diarrhea he'll be already losing so much of fluid from his body without proper replacement. So at this time, if we take another 450 ml from his circulation, some people may not be able to cope up with that loss, so we have to defer them for 2 weeks period. And in case of any GI endoscopy being made in the patient, we have to defer them for 1 year period. And in cases of any acid peptic disease, not all, because all the people will be complaining of gas problem, I'm taking gas tablet is the most common history we encounter, but it is not this deferral criteria is not for everyone. We have to assess them whether they have any severe stomach ulcer kind of symptoms, and whether they are telling any kind of evidence of recurrent bleeding. We have to assess them, and if we feel that they have a very good chance of getting some stomach ulcer, please defer them permanently. And in case of any rheumatic diseases like SLE, scleroderma, dermatomyositis, ankylosing spondylitis, or any recurrent bleeding, we can undoubtedly we can defer them permanently. And some of the other diseases which in which we advise permanent deferral are polycythemia vera, bleeding diseases, malignancy, severe allergy, hemoglobinopathies like thalassemia, and red cell enzyme deficiencies like G6PD deficiency, and any known history of hemolysis, we can defer them permanently. Coming on to the vaccines part, like it is like to say a simple, any killed vaccines or toxoids, we have to defer them for 2 weeks period, and any live vaccines, we have to defer them for 4 weeks period. It is as simple as such. And this non-live, that is the killed vaccines and toxoids, previously this was not coming under this criteria, but now they have added because they have found the risks of transmission of the viruses even in cases of killed vaccines due to the improper maybe due to the improper inactivation techniques used by the manufacturers. But to be on safer side, please do not accept them for 2 weeks period post vaccinations from killed vaccines. And this some examples are typhoid vaccines, cholera, papillomavirus, influenza, meningococcal, pertussis, pneumococcal, IPV, diphtheria, tetanus, and plague. This is a very new update which is being recently added in this March 11, 2020. Coming on to the live attenuated vaccines, the vaccines like OPV, measles, rubella, mumps, yellow fever vaccine, Japanese encephalitis vaccine, influenza vaccine, typhoid, cholera, and hepatitis A vaccines are some of the live vaccines available in India. And in case of any vaccinations from these, we have to defer them for a period of 1 month, that is 4 weeks post vaccination. Coming on to the serum and immunoglobulin part, if a person has taken any serum like antivenom serum or anti-tetanus serum or anti-diphtheria serum or anti-gas gangrene serum, we have to defer them for 1 month period. That is, as I said before, for live vaccines. Actually it is 28 days, but we can remember it as 1 month. Okay. And coming on to the immunoglobulin part, this history also we have to keep in mind, because most of the people not most like many people complain of history of ARV taken for some kind of dog bite or cat bite kind of things. So we have to remember it that post ARV vaccination or hepatitis B immunoglobulins or any immunoglobulins, we have to defer them for a period of 1 year. This reason is because many of you may have a doubt, why 1 year? Because the ARV was previously manufactured from horse brain. Okay, the horse brain. So there were evidences of prions disease coming in the recipients who received the blood from those donors who are taken who are given their blood within 1 year of their ARV injections. and that's why they made it as a 1 year gap between the ARV vaccination and the blood donation. But however, nowadays many recombinant ARVs have come, but still this criteria is same. That's why we have to leave a period of 1 year. This is quite common history, so we have to keep this in mind. Coming on to the drugs part, which is very difficult to remember, very practically speaking, it is very difficult to remember for anyone. But if we have a doubt of any medicines, whether we can accept them or not accept them, please defer them for at least 2 weeks period. Okay, it's not the same for every drugs, but at least 2 weeks period you just leave a gap, because this is because some drugs have their action actually, they get attached to the RBC particles, or they can be seen in the plasma for certain number of days even after stopping the medications. So that's why there is a chance of them getting transmitted to the recipients, and that might cause some kind of drug interactions or some kind of adverse reactions in the recipients. That's why we defer people taking the drugs. Some of the common drugs I'll be encountering in this discussion, they are like salicylates, like aspirin or any other NSAIDs like diclofenac, aceclofenac, those things we have to defer them for at least 3 days, or you can accept them for donation, but please make sure that we do not prepare any platelets from their blood, because the receptors will be blocked by these NSAIDs, and that platelet will not be effective. So even if you want to take blood, we can take blood from those who taking salicylates, but do not prepare platelets. Coming on to the antifungals like ketoconazole or antihelminthic, including mebendazole, defer them for a period of 1 week, but make sure that they do not have any active fungal infection at the time of presentation to the blood center. If you feel that they still have any active fungal infection, please do not take them for donation, at least for that period of time. And in any cases of any antibiotic intake, please defer them for a period of 2 weeks, and this 2 weeks criteria also suits for ticlopidin, clopidogrel, piroxicam and dipyridamole. And it is 1 month deferral period for types of isotretinoin like 8-tritinate, acitretin, isotretinoin, which are used for acne treatment, and finasteride, which is used for BPH treatment. For the BPH treatment only, we have 2 drugs like finasteride, dutasteride. For finasteride, it is 1 month period of deferral, and dutasteride, it is 6 months period of deferral. And if the donor gives any history of any radioactive material being taken by him, like in case of any contrast, CT contrast is taken, such kind of things, you have to leave a period of 2 months since the time of taking those drugs. And practically this is not possible to remember all the time, but at least the common things like antibiotics, antifungals, NSAIDs, those kind of things we can remember. Coming on to some other group of drugs in which we advise a permanent deferral are antiarrhythmic drugs, anticonvulsant drugs, anticoagulant drugs, antithyroid drugs, cytotoxic drugs or cardiac failure drugs. All these kind of drugs we have to give a permanent deferral, and we have to permanently defer those donors who have undergone any organ transplant or stem cell or tissue transplant, or those having any unexplained fainting episodes, or at the time of previous donation, if he has had some delayed fainting with injury, such a serious kind of fainting episodes, we have to defer them. And in case of 2 consecutive fainting episodes, in case of fainting episodes in 2 consecutive donations, I should say 2 consecutive donations, if he is having fainting episodes followed by donation, he should be permanently deferred from donation for his safety. Now we have to know about what drugs we can accept during the time of donation. Some of them commonly encountered drugs are oral contraceptive pills, analgesics, vitamins, mild sedatives, allopurinol, cholesterol under medications like statins, then OHAs and antihypertensives if their dose is not altered in the last 1 month. All these drugs we can safely accept them at the time of donation. As I said before, I have prepared a summary of all those permanent deferral criteria which I discussed in this discussion. They are asthma, the donors with asthma, those who have undergone cardiac surgery, cancer surgery, all the cardiac diseases and the cardiac medications, those taking anticonvulsants, antiepileptics, and those having histories of seizures, having history of hepatitis B, C, unknown hepatitis, chronic liver disease, liver failure, symptoms of AIDS like lymphadenopathy, prolonged and repeated fever, prolonged and repeated diarrhea, irrespective of HIV risk, syphilis, history with evidences of genital sores or generalized skin rashes, evidences of gonorrhea, leishmaniasis, leprosy, CKD, renal failure, evidences of acid peptic disease, any severe suspected diseases. If you suspect, you can defer them, and autoimmune diseases like SLE, scleroderma, ankylosing spondylitis, severe rheumatoid arthritis kind of things, polycythemia vera, and any bleeding diseases or unexplained bleeding histories, you can defer them. One more thing which is being missed in this is this notes is that those people who are under insulin for diabetic control, they also come under this permanent deferral criteria. Now coming on to the most important part of our discussion today, and the hot topic of the society today is the COVID-19 and the convalescent plasma donation. It is being seen all over India that convalescent plasma is showing some good prognostic signs in people with moderate and severe COVID. But however, its effect is not very well proven. It is showing it is 80%. It is showing good improvement in those people with moderate and severe COVID diseases. And as a doctor, all of us, not only the transfusion medicine people, but all of us, all the doctors should be aware of the eligibility criteria for a person to donate his plasma after he has recovered from COVID. Even many of us would have been recovered from COVID, and if we are willing to donate our plasma, we should know whether we are eligible or not for our plasma donation. And coming on to the criteria for this, the criteria of age, weight, BP, pulse, hemoglobin, hematocrit, all the systemic conditions, STI screening, drug histories, vaccinations, and surgery history, everything is same as usual donation, which has been discussed in this discussion previously. All these are the same, and some of the extra things we have to note in case of convalescent plasma donation is that the accessibility of the veins, because this plasma donation, this process is not some magic or something. It is like the concept is like dialysis. What we do is we take the blood of the donor from one vein, and then we mix it with anticoagulant, bring it into the machine. Inside the machine, that mixed blood with anticoagulant will be centrifuged, and according to the different gravitational different specific gravity of different components of blood, the plasma will be separated and the RBC will be separated, and this separated plasma will be collected in one port and collected in one bag separately, and the remaining RBCs will be returned back to the donor at the time of donation only through another one vein. So this is what happens, and the method and the system can be different according to the manufacturers. There are double prick machines, single prick machines, continuous machines, intermittent machines, and so on. But however, we have to see for the accessibility of veins, so as to make sure that all the remaining RBCs will be returned back to the donor completely, to avoid any reduction in the hemoglobin, nothing else. So the veins has to be examined, and we have to make sure that we do not take any lipidemic diet or non-vegetarian diet 12 hours prior to the donation. It's because if we take some lipidemic diet, our plasma will be lipidemic and the effectiveness of the antibodies will be very less. And it is ideal to check our IgG antibody via some rapid test, which is available in most of the centers, I suppose. And if possible, the antibody titer can be seen. Those with good titer have shown very good and very fast recovery in the patients. but the titer is not measured in all the centers, I think. But at least we have to see for the presence of IgG antibody, and what time we should donate, that is very important. We should donate 14 days or 14 to 28 days after the recovery from the symptoms. So this indirectly means that the donor who is willing to donate his plasma should be a symptomatic and recovered COVID positive patient. So after his symptoms, after the disappearance of his symptoms, he should have at least 14 to 28 days gap to donate his plasma. And in case of females, the other criteria has to be screened, and extra we have to rule out the pregnancies because of the issues of HLA antigens. We have to rule out the pregnancy before we take them for plasma donation for COVID. And since as I said before, in this procedure we will be mixing the donor blood along with anticoagulants, and the blood that and the RBCs which is returning back into the patient, which is returning back to the donor, will be having that anticoagulant. So some people have shown some citrate toxicity because the anticoagulant mostly used is acid citrate dextrose, and so to prevent this citrate toxicity, prophylactic calcium 2 gram is given to the donors. So nothing to be worried of. It is quite a safe process, and there is nothing to get anxiety or about the process. And if any of the friends who are watching this video are recovered symptomatic COVID patients, please come forward for donation. Screen yourself for the eligibility for donation and please come forward. And you can have a very good and very genuine doubt that today we have many kind of strains of COVID. Today they say that it is around 9 strains present in India by now, but however we are collecting the convalescent plasma now. We can have a doubt whether, like, due to different strains, whether the plasma collected from a donor in South India, say Tamil Nadu, can it be given to a recipient present severe COVID patient who is present in Mumbai? Maybe even if they are different strains, do they have any effect? That is a very good doubt. And for this, the answer is yes, because we have to understand that the convalescent plasma which we are giving to that COVID patient is nothing but the IgG antibody. This IgG antibody is formed against the RNA of the virus, and the different strains of the virus are due to differences in their surface antigens. So even if you give a recovered patient due to some different strain, if you are taking his plasma and giving to a patient affected with different strain, if convalescent plasma has some effect, it will have some effect irrespective of the strains. Okay. And I think this is all about the discussion. And everyone, please be safe. Have a safe fight against COVID. Thank you.